Hey, welcome to Girl Talk. We have a pretty exciting show for you today. We're filming here at Radiance Skin Therapy off of Todd Drive, and we're going to talk about some things that I think are related to New Year's, kind of resolution type items, right?
Absolutely.
Do you have a good New Year's celebration, ladies? Anything interesting?
From what I remember, it was so fun.
So yes, you had a great one.
Yes, I did.
That's awesome. I didn't make it to midnight, unfortunately. I fell asleep on the couch. So I'm very boring, but I'm having a good start to my year. So.
You're busy making a baby.
I know. Yeah, that's my
like,
excuse. Yeah, wasn't all about it. But thinking about some resolutions, we've got some cool things to talk about today. We're going to talk a little bit about kids' oral hygiene. We'll talk about that with Dr. Sargent later, and some fitness things on the agenda.
So different fitness things.
Couple fitness things, yeah.
Fun and different.
Different fitness ideas. One thing I'm really excited to talk about is a little bit later, we're going to chat with Anne, the owner of Radiance, about cool sculpting, which is a new technology for folks who have some trouble areas that they want to burn some extra fat. So who doesn't want to know about that?
From the little bit that I've looked into it on her website, like it permanently kills the fat cells. That's incredible.
Yeah.
And Anne's business here is one of the first in Madison. I don't know if they're the only ones now, but they're the first to have this here. This is FDA approved. It was developed by a guy at Harvard, so this is not some...
Yeah, I've never heard of it before.
Yeah.
This is literally the only place in just about all of Wisconsin, I even think, that you can get this treatment, and it's surgery free, which is just amazing. So still do your workouts, still keep your New Year's resolutions, but when you have those extra little spots, we're going to learn about that.
Won't go away.
Such neat things. And actually last time we were here, I'm going to put you on the spot, Elise, but last time we were here, you had your first Botox treatment.
I did. And what do you think?
You look fabulous. You looked fabulous before, but you look even more fabulous.
Well, I mean, I think each person, they know their face better than anyone else. And you know your lines better than anyone else and what annoys you and picks at you. And I have really strong facial muscles. That's what Anne tells me. And these lines up here just really bothered me. And they are gone.
They're gone.
And I have to keep up with treatments, but it's like, I think she said every 6 months. And since I'm doing it when I'm younger, they will never be there in my older age. So I'm like, I'm really happy about it.
This is like a really great preventative for you because you're starting before you really have, I know they bothered you, but before you really have lines.
And it was so easy. I hope that people saw the episode. Anne did tell me that someone came in and said they saw me do it and how easy it was, and then they weren't scared anymore.
It really doesn't hurt at all.
No, well, none of the stuff that she does here. It's like all, non-surgical procedures.
Dramatic results without the surgery.
Right.
Yeah.
And she's got a great bedside manner. She's very
she's
compassionate.
fabulous.
She's fantastic.
Excellent. So we'll talk more about some other treatments later, like we mentioned, and we're going to talk prenatal fitness, which is neat, with Orange Shoe. Our gurus are back, so good timing for me for New Year's resolutions and being pregnant, so that'll be kind of fun. Just a little different fitness topic for us. So if you're at home and you're expecting, some good tips are going to be coming your way. But also, did you know February is Kids Health Month?
Yeah.
Dental Health Month.
Dental Health Month, yes, excuse me. So that's coming up faster than we know, but I'm okay with February coming. January is cold.
Yeah, it is cold. It just seems like yesterday we were going, oh, it's almost winter, but it was so nice out. We're still wearing skirts.
Yeah.
And now it's freezing.
I'll take it though. It's so much better than last year in Wisconsin. Were you here for that?
Yes.
Or did you miss it?
No, I think I was here right at the beginning of the frigid cold coming in.
Welcome to Wisco.
Brutal.
It's relentless, isn't it?
Lots of shoveling last year. At least we're not shoveling so much.
That's true.
Have you seen that on Facebook where it's like, the wind or the air hurts my face? Why do I live somewhere where the air hurts my face?
It's true. Well, we'll have to brave it for a little bit longer. We are going to talk kids' health coming up after the break. Stick around for more Girl Talk.
Welcome back to Girl Talk. February is Children's Dental Month, and we have got one of my favorites, Dr. Amy Sargent here from Excellence in Dentistry. Thanks for coming.
Thanks for having me.
So, Dr. Sargent, you said that Children's Dental Health Month is coming up, and why is it so important for kids?
Well, it's important for everyone, but especially for kids, because I think there's lack of awareness that tooth decay is the second most common disease in the U.S. after the common cold.
Wow, I didn't know.
That's awful.
That's disgusting, yeah. But good to know.
Good to know, right.
So, how early does this happen, and what's related with tooth decay? How early can you tell that this is going on in children?
Well, surprisingly, we do see cavities in kids as young as 1 year old.
Wow. 1 year?
Right.
That's
How
crazy.
does that even happen?
Well, I think that one of the main things that can cause this is a high sugar diet. So a lot of juice. I wouldn't say that kids that are 1 are drinking soda, but certainly older kids are drinking soda, sports drinks, those kinds of things. And then the other thing would be kind of the lack of knowledge of how to care for a child's teeth.
Okay.
So why do you think, obviously it's an issue based on just the health issues, of course, but
Right.
why do you think it's an issue in terms of taking care of these problems?
Well, I think that the kind of the old guidelines that a lot of people still follow is to get the child to the dentist by the age of 3. So some of these problems we're seeing are occurring before the age of 3, so we're not even able to see that they are a problem. So we want to be sure people are aware that this is a problem that's happening. We need to get the kids in as early as possible.
Really? So really starting pretty much right away.
Right
How
away.
early do you think?
By the age of 1.
Wow. Okay.
Wow.
So this is you're born. We get you to the dentist. Let's go. Absolutely. But I mean, as soon as you have teeth, I suppose it
Right.
starts becoming oral hygiene is important.
Well,
Right.
it's the habit, I would imagine,
Right.
getting them used to properly cleaning their teeth.
Right.
So what happens if they have cavities? I mean, can you actually fix cavities when they're that young?
Yep, we do need to fix them. We definitely need to fix them because
They're baby
cavities.
teeth. Can't they just fall out?
Right, that's such a good question. We hear that a lot. No, we want to fix them so that they don't cause pain and infection, just like an adult cavity does.
Yeah.
A child's cavity can cause that as well. And even more importantly, they can't sometimes verbalize that they're having discomfort.
Right.
So we have to fix them. We also need to fix them because they're going to be in there for a while. Some of those teeth are going to be in the mouth till like 12.
So if they're crying and fussy and their tooth
They
hurts,
might-
don't give them more candy just to make
Don't
them
give them more
happy.
candy. Right. The other reason we want to be sure and fix them is we want to keep those teeth healthy to maintain what we call arch space so that there's enough room for the permanent teeth to fit in there.
Oh, that makes sense.
Yep.
So what can we do? The parents, the teachers, other health providers, what can they be doing?
Well, I think one thing we want the healthcare providers to do specifically is to be sure they're encouraging parents to get their child to the dentist in a timely manner. So we want to say by 1. We want the children to be very comfortable in the dental office. We want it to be very routine for them. We don't want it to be anything scary. It shouldn't be.
Makes sense.
Yeah, we want it to be as routine as going to the pediatrician.
Sure.
So that if they do need treatment, they're not fearful. And this is just a happy place to go where everybody's nice and taking care of them.
And I think probably establishing that habit and getting them used to being there too.
Right.
It's just something that's part of their routine
Right.
from really when they can remember.
Yep.
So do you think that's the take-home message here, or what's really
Yep.
the message to help keep kids' teeth healthy through life?
So the first thing is awareness, which is what we're trying to do right now, make everybody aware that it's a problem. Once you're aware, you can take steps to remedy the problem. The next thing is assistance. I didn't mention this earlier, but what I want to mention is that as most people know, kids don't have really great dexterity, even until about kindergarten, so they're really not going to be the best brushers. So we want parents to be helping the children brush until they're really getting in there really well and getting things clean. The next thing is following a low sugar diet. Certainly nobody needs a bunch of sugar, especially on their teeth.
Right. There's multiple health reasons
Exactly.
there. Yeah.
Real
Yep.
quick, what kind of toothbrush should children be using? Soft, medium, hard? Does
Soft
it matter?
toothbrushes,
Soft?
yep, small children's toothbrushes. At a certain age, we start to give out spin brushes as well.
Sure.
Yep.
Cool. Well,
like
lots
that.
of great information. Who knew?
I didn't. Oh, that's really
So
fascinating.
get those kids in early, especially for February, which is Children's Dental Health Month. So thank you, Dr. Sargent, for coming on in.
Thank you.
We're going to be back with more Girl Talk, Orange Sheep Fitness, back in a moment.
Welcome back to Girl Talk. Last segment we talked about children's oral health. Now we're going to be talking about fitness if you've got one on the way, and who better to do that? We've got Dusty Madison, who joins us from Orange Shoe Personal Fitness, our fitness gurus. Welcome to Girl Talk.
Thank you for having me.
Yeah, we're so excited to have you. What a neat topic. Good timing for me.
I know, right? Perfect.
Yeah, perfect timing. And tell me just a little bit about, first of all, how you got into prenatal fitness, and also, you know, really, who is this for? Can anyone do this?
Yeah, for sure. I have a little boy who will be 3 in February, and when I was pregnant, I was looking for a prenatal fitness class that would challenge me. So I really found, you know, a couple ideas, yoga, water aerobics, wonderful options, but I've been an athlete my whole life and I wanted something more, and I wanted to be with other pregnant women, and I just didn't find it. So I've become very passionate about this population of women who maybe want something more.
Absolutely. It's tough to find options out there, and to your point, that are really specifically for while you're with child. So
Yeah.
that's great that you got into that. Wonderful.
It sounds so obvious that this prenatal fitness is important while you're pregnant, but I'm kind of clueless in the subject. What benefits come from prenatal fitness?
Well, what's so amazing is there's benefits for both the baby and the mother. So
Okay.
it's not just the mother. So that's super important. So for the baby, it increases the physical health benefits right away from birth all the way through adulthood. Also increases intelligence scores all the way through life, as well as gives them confidence and be able to self-soothe, and then also decreases fewer complications, as well as one other thing. all kinds of things.
A lot of benefits.
It's so fascinating. It's like, how could you not?
Well, I know, and then for the mother, less weight gain, less complications during pregnancy. So definitely some great benefits.
Both probably very important things.
Absolutely. Yeah, all good things. That's
Sure,
wonderful.
and I've heard that it can help with back pain or even help you sleep better, which can get pretty uncomfortable.
For sure.
Yeah.
I mean, you know, it just decreases some of those uncomfortable.
Sure.
Yeah.
So earlier, you and I were talking about your philosophy on prenatal fitness. Why don't you share that with the viewers here?
Yeah, for sure. Well, like I said before, you know, I've been an athlete my whole life, and going into being pregnant, I thought of going into labor and delivery as training for an athletic event. So you wouldn't just go run a marathon, you know, the next day. And I think the same thing goes for being pregnant. I think it's, you know, really your responsibility to be healthy going into it. And I want women to see pregnancy as this natural thing that happens instead of a sickness. And I think a lot of times that's how pregnancy is viewed, is, oh, we can't, you know, can't do this, you can't do that. And there's a lot of guidelines out there that really put a lot of restrictions on women when they're pregnant. And I want to say, just go for it. If you feel good, go for it.
Let your body kind of be the guide, and a little bit, you know, follow how you're feeling.
Exactly.
Kind of philosophy. What do you think is important as you're doing these workouts? Is there a specific thing to focus on? What do you feel like is an important area of focus?
For sure. Well, it's really important to work on muscle balance. So, I mean, that's for anyone out there. But going into pregnancy with your body changing and whatnot, muscle balance is really important, as well as muscle activation. And what I mean by that is there's 3 key areas. First is core, and that includes activating the pelvic floor, so Kegels, which I'm sure most people have heard of. Also deep breathing, which is important for everyone, but it really helps increase the musculature as well as relieve stress. So, you know, you don't want that baby to be stressed, and if you're stressed, they're gonna feel it. And the other one is the back muscles and also the glutes. So having those 3
Sounds
things
like
are
you kind of focus on the whole body.
Well,
Do the workouts change from trimester to trimester?
They can, but it's really individual.
Okay.
So, I mean, just like any fitness program, you got to go with the individual. So, you know, from first trimester, a lot of people feel maybe some morning sickness and fatigue, so they back off a little bit, and that's fine, but they don't have to. And then second trimester, you want to just obviously watch out for being on the belly.
Sure. And I want to mention real quick, we got to go, but there's a class coming up called Mama to Be, March 5th. That is going to be starting on Thursday nights at 6 p.m. And so if you're looking for a little bit of prenatal workout fitness tips, you can wait for that class, or you can just see these guys over at Orange Fitness. Thank you so much, Orange Shoe Personal Fitness. Thank you, Dusty, for joining us. Greatly appreciated.
It's my pleasure. Thank you.
Stick around because we are going to be talking about a cool new technology to help you burn fat in those trouble areas, surgery-free. Stick around for more Girl Talk here at Radiance Skin Therapy. Welcome back to Girl Talk. We are filming here at Radiance Skin Therapy. This is the segment you've been waiting for. We finally have the opportunity to sit down with Ann Hill, who is going to enlighten us on a very cool, pun intended, new technology that is surgery-free that helps you with those stubborn fat areas. So I'm sure you're listening. And welcome to Girl Talk. Thanks for having us again. We love being here.
See you guys.
Who couldn't use this after the holidays?
Yeah, exactly.
Seriously.
This is the neatest thing, and I'm sure every woman out there has some area on her body that she's already thinking of right now for this technology. So give us a little bit of an overview of what Cool Sculpting is.
Sure. It's a treatment that actually destroys fat cells. So we put an applicator on a specific area of the body that you might be having a little stubborn fat, and it sits on there for about an hour. And during that time, it takes the fat cells down to kind of a freezing point. And scientists discovered that fat can't tolerate it. And so they self-destruct. It causes apoptosis of the fat cell, and they die. And then over the course of 4 to 16 weeks, your body naturally eliminates those dead fat cells.
Isn't that great?
Yeah.
No surgery.
No surgery, or you could just go lay in a snowbank right now today.
Probably not quite the same.
Right. Yeah.
That sounds amazing.
Yeah.
But you know, we're kind of bombarded by all these different remedies and treatments and ways to get rid of fat. Why is Cool Sculpting the better choice?
Sure, there's many things out there, but you want to make sure that if you're going in for a treatment and it's supposed to affect fat, is it permanent? I mean, and we can never say anything's permanent, especially with people fluctuate in their weight. But if you stay consistent with your weight and you lose fat cells, just like a physician going in there and kind of sucking them out, those are gone, okay? And it's the same with Cool Sculpting. Those fat cells are destroyed. They're not still there, and they get bigger and they get smaller. They're gone. And so a lot of our wraps or different treatments out there are a temporary fix, okay? So this is not a treatment that you're gonna have to come back and back and back to keep having your result. You get your result, you stay at your same weight, and you should be good to go.
Well, yeah, why would you spend money on something else when you could do it once?
Right, exactly.
Absolutely.
And it's not a license to go eat and overindulge.
No celebrating with Choco Tacos afterwards?
No, we still need to work out, we still need to eat healthy, and that's what's gonna keep those areas that we fight with thin and trim, and without the little excess fat. So it's really for people who are working out and doing the right things, and they just can't get rid of that little excess fat.
I think everyone's got their one trouble spot that just will not.
Who doesn't?
It's
Right.
okay if you have a few. You can do all sorts of spots.
You can have a few.
Okay. Let's talk about the downtime.
Yeah.
So you said you have this thing on for about an hour. It takes a couple months for the effects to really show, but what's the downtime after the procedure?
There is no downtime. You have no restrictions. So, we've had people who are off the table and they're saying, you know what, I'm gonna go do CrossFit or I'm gonna go for a run. We don't restrict you in any way. Now, sometimes people have a little bit of tenderness in those areas. So sometimes people aren't going to do that. I mean, they might miss a couple workouts the day of or the day after or something like that, but that's usually it. It's usually pretty much no downtime.
That's wonderful. Yeah, I mean, I want to talk a little bit about in terms of what spaces too. So now that we've got everyone's attention, there's no downtime. It's safe, it's permanent. I mean, I'm sure there's women everywhere that want to do this treatment. So where can you do it? Is it just stomach? Is it anywhere that you have trouble areas? What kind of areas do you typically treat?
Typically we treat stomach, lower, upper, all the way around the trunk. So even up in the bra fat, you know, we call them the love handles. We can do inner thighs, and now there's a new applicator that actually does outer thighs. So when I spoke before that it's a 1 hour treatment, the thighs actually get a 2 hour on each side. But we now have that, and that's the reason for that is because it's a little bit thicker fat, so the cold takes a little bit longer to penetrate in there. And so, you know, really it's upper legs and anywhere in the trunk, and we've, you know, also done some arms.
Wow. So pretty much anywhere, you know, those typical areas that we struggle with, and even when you are healthy and fit and losing weight, there's, you know, oftentimes that one spot on your body, everyone's body has their favorite spot that it likes to just hang on. Yeah. And this is the solution for that.
Yeah, absolutely. And there's, you know, there's no evidence of it, so you don't have a scar. You know, people, nobody would ever know that you did it. You know, and that's, some people like to keep everything private, and so this way you can, there's no evidence of it.
Wonderful. Wonderful benefit.
Yeah, exactly.
So I'm an instant gratification kind of lady. So I like do something, I decide I want to do it, and then I just want to look good.
Right.
How long would I need to wait for results if I came in for something like this?
Yeah, it's going to vary. There are people who eliminate fat very quickly. I mean, their body just will eliminate it. And some people would see results in as little as 4 weeks.
That's not bad.
No, but some people are more on that 4, 8, 12, even up to 16 they could keep losing. But usually by 8 weeks, we're seeing a before and after type of picture that we could show.
Does it depend on like metabolism? If you work out harder, it's just your body?
It's just your body. We have no reason for who loses it, you know, quicker or slower or whatever.
Well, this is awesome, and thank you so much for sharing your wisdom on such a neat treatment. And it's a great, affordable way to permanently remove fat from those trouble spots. So give them a call here at Radiance Skin Therapy if you're interested. Thank you, Anne, for joining us. Thanks to all of our guests for joining us here on Girl Talk, and thank you for watching. Please join us next time.